And so, shall we start the screens sharing?
Yes.
Suicide actually is a major mental health problem of our times. It is considered as one among the 10 leading cause of death and leading cause of death. And WHO defines suicide as a deliberate act of self-harm with a fatal outcome. Actually, it is a tragic and untimely loss of human life. And moreover, it is a volitional act. Each suicide has a personal tragedy in that it takes the life of an individual prematurely. And it has a continuing and ripple effect on the lives of the family, friends, or the community in which the person is related. Every year, there is more than 1 lakh people committing suicide in our country. And the suicide rate in India is comparatively higher than that of the world. In the year 2019, about more than 1,40,000 suicide in India was reported. Out of this, 6.5% was from Kerala. And the state suicide rate is comparatively more than the national average. And the state suicide rate is 24.3 compared to the national average, which is 10.4%. And WHO also shows that there are at least 8 lakh suicide in a year in the world. And the next slide, and the states, southern states has more suicidal behavior compared to the northern states also. And the data on the National Crime Research Bureau shows the data shows the year, the number of suicide and the rate of suicide from 2015 to 2019. And in 2019, there are 1,39,123 suicides in number. And it is the suicide rate is about 10.4%. And India has one of the highest suicide rate in the world. And the number of males committing suicide is more than the females. And statewide suicide rate is also noticed in the data. Actually, Maharashtra has the highest suicide rate. Then comes Tamil Nadu, West Bengal, Madhya Pradesh, Karnataka, and Kerala. There are certain factors which indicate that the number of suicide differ in certain areas. Like married people, the amount of suicide in married people is more than the suicide in unmarried people. Economic status, social status, educational status, and sex difference is also noticed in the difference in the amount, percentage of suicide. More than the number of suicide, the amount of attempted suicide is 8 to 10 times more than the suicide. After the people who attempt suicide, about 25% of them escape the suicide attempt. And in adolescent and youth, about the adolescent suicide, adolescent and youth are particularly more vulnerable to suicide on account of their emotional immaturity and the temperamental instability. And we all know that it's a growing age, there will be many physical and hormonal changes coming up in the body, and so the brain also is getting mature only. Because of this influence of this hormonal influence, plus the environmental stresses, all this causing them more vulnerable to the suicide. And in adults, and suicide is the second leading cause of death among the college and school-going students from 15 to 19 years of age. And it is noted that attempted suicide is 8 to 10 times more than the committed suicide. Committed suicide is more among males, the ratio 3:1. And attempted suicide is more reported in females, and the ratio is 4:1. It is noted that at least 1 suicide per hour and 28 suicides per day, according to some crime records data. And another data from the State Crime Records Bureau shows the number of children who committed suicide in the following years. In 2014, there are 330 children who committed suicide. 2015 to 97 children, and 2016 to 43 children. And in the adolescent age, 2018, 2016, the number of suicide was 9,478 in national crime research data. 2017, it was 9,905, and 2018, it was more than 10,000. And in the subsequent year, it was all the more at least 3.4% more in number compared to the previous year. In another study by the State Crime Research Bureau, in 2020, along with the COVID time, they conducted the study for a short period from 2020 March 25th to July 10th, that is more 110 days. There were 66 number of suicide reported, and corresponding to the previous year, it was 83. And out of the 66 suicide, 64 of them were the age group of 12 to 18 years, and 2 of them were below 12 years. And of this, 61 of them was done the suicide by hanging, 3 by poisoning, and 1 by jumping from the height, and another 1 by setting fire on it. There is no acceptable reason why a person commits suicide. For many, it is a response to a loss, failure, or a response to a desperate situation which they find it difficult to face. Negative expectations or hopelessness is an important preoccupation with all these people. They believe that suicide is the only possible strategy to deal with their problems. And a sense of loneliness, hopelessness, and helplessness prevail in all these cases. And they think that there is no other way. And so they think that suicide is the only way. Suicide and attempted suicide actually carry a burden on the society. It means a socio-economic burden to the family or friends and the society. Hence, the suicide behavior is considered as a major public health problem, and so that is why we are thinking of preventing such incidents. And the reason for suicide in many, I already mentioned, it's feeling of hopelessness, of helplessness, or worthlessness. Some unbearable stress also is a reason for some people to attempt suicide, like loss of a dear one, loss by separation, or failure in exam, or love failure, some sort of conflicts which is ambivalent in thoughts, some unmet needs and desires, like some people who find it difficult to get what they need. Sometimes it may be, there are few incidents in our state also recently during the lockdown period, online classes, some students couldn't meet their needs of finding articles like computer or screens or TV for attending the online classes, and some of them felt bad about it. And one girl who committed suicide, which was reported. And there are other incidents of adolescent suicide also, which was reported. Some other causes, like the narrowing of the perceived options. They feel that they have no other option, so they don't think of anything else but take a decision on taking their life. And for some, it is a need to escape from some stresses, like within the family, or burden of damage done, or educational stresses, like they can't bear the burden of education. Some find it difficult to carry on with their studies, or topics difficult, or the syllabus is difficult. Such things also make some students resort to the last resort, the suicide. There are many factors which influence the suicide, and the first and most important of this is the biological factors. Biological factors, as you see, it is a genetic cause, that is the inherent genetic inherence, which make a person predisposed to mental illness. Many of the mental illness has got a genetic predisposition, but need not be always genetic, but otherwise also you can get a depressive disorder or a psychotic disorder. But only thing, genetic predisposition make a person more vulnerable to psychiatric illnesses. Depression is one of the very common cause of suicide and a reason cause for suicide. And another factor which is, many of the mental illness which results in some sort of difficulties, depressive disorder, psychotic disorder, some personality disorders where the temperament of the person is difficult to adapt to the real world stresses. So they change their attitude towards the problem and go for a suicide attempt. And environmental factors which cause this suicide, influencing the suicide, is the stresses in life and the conflicts they face around them in the family or in the school, like curriculum, difficulties with the curriculum, attitude of the teachers or the family regarding the studies, pressure from the peers, attitude of the peers. Such things can cause conflict in them and causes stress. And the stress they have to face usually is like loss of life, loss in their life, like already mentioned that loss of love affair or failure in exams, breaking up of a relationship, a friend, or a loss of a loved one, parent, or death by separation, separation due to death, or separation of the parents and you lose one parent. Such things also can result in the influence the act of suicide. The other factor is the psychosocial factors. And most important of them is a lack of social support or a loss of support from the family, the neighbors, interpersonal relationship, not adequate enough to maintain a support system. And the one is the financial burden or the financial loss, which causes stress to the family or the parents, and that in turn affect the children, and they go into some negative influences. Again, a sense of isolation. I have nobody else. I am alone, and that sort of sense, if it is severe, and feel that I have nobody else, a sense of loneliness, also influence the suicide in a person. So for that, we have to look for the risk factors in suicide. Always, when you consider the risk factors, why it is important is because these risk factors are the ones who decide in our management or intervention in preventing suicide. So always the previous suicide attempt is one of the most important risk factor, because most often when an suicide attempt is done and it doesn't become successful, it is an attempted suicide. And such people have always got a tendency to attempt again. And the most riskiest period is first 3 months after a suicide attempt. So in during this period, somebody has to be careful in dealing with this person, have to alert the family, take professional help, meet psychiatric professional, and seek help. Another risk factor is poor mental health in a person, like psychiatric illness or temperamental problems. Like depressive disorder is definitely a risk factor for suicide. A psychotic disorder, substance abuse, and severe dependence on drugs or alcohol, and the personality traits. Of this, the impulsive type of personality and emotionally unstable personality traits are the most vulnerable people that leads to suicide. They have poor adjustment skills and adaptive skills. And so their problem solving skills also are inadequate. This inadequacy is a cause for a suicide. And so that is this type of personality impulsive type, or emotionally unstable, people with poor adaptive skills. Such person are also at risk for suicide. Another risk factor is an important life event which occurs in a person's life. Loss of both parents, separation from parents due to divorce from parents, failures, severe trauma. Severe trauma in a person like sexual abuse, violence and abuse, or forced marriage, severe disasters and calamities. Recent few incidents which occurred in our state is also an example. Another life event is loss of job or unemployment. Another life event is a person having a severe accident and ending up in physical disability, severe pain, and which is a chronic condition, which results in a functional impairment. Such a person has every chance of going into a depression or negative thoughts. And when the condition is very chronic and causing disability and impairment in one's function, such people tend to be less productive and they become isolated or they're withdrawn and their functioning is also impaired. So they have thought about themselves as negative. I'm not good enough to carry on the life. I'm not um, I'm not useful to anybody, so I may be a burden to anybody. So such thoughts make a person at risk for suicide. Another problem which we face and which is more happening in recent time is this victims of cybercrime. Such students, adolescents, and even adults who face such uh, victimization like bullying, online difficulties, and some sort of game addiction, and then resulting in conflicts uh, with the system, with the family, with the teachers, and their performance. And when it is students, their performance is impaired. If it is working class, the performance in the job is impaired. And so they lose interest in the surroundings. Their only importance is involving this addiction game and then withdrawn from the environment. Then the reaction from the family, all this leads them to depressive thoughts or negative conclusions, and then they are at risk for a negative event like a suicide. So what we can do? You look for the warning signs. How to identify, like you have to, the risk factors just now we told, and then you look for the warning signs. Usually, most often, 80% of the people who have intention to take their life communicate to somebody in some way or the other. Usually, it happens. But one myth we all maintain is like a person who talk about taking their life won't do it. That is what we think. Actually, it is not so. A person who frequently talk about death, want to take their life, threatening to kill themselves, all these people have to be taken seriously rather than ignoring it. And so, warning sign is like a person who is showing a change in their recent changes in the behavior and mood. Most often, they are withdrawn, isolated, depressed, sad, and not showing interest in their work or studies. Some students, they don't go to school for days or weeks, mood changes, loss of appetite and loss of sleep. They have poor personal care. They don't take bath, don't take uh, eat food on time, and they don't care about themselves and loss of interest in anything. Don't talk much. Some people uh, give indirect indications of suicide. When usually the suicide threats, like they're threatening some adolescent, usually it happens in adolescent males than girls. Say they threaten to commit suicide. that it all depends on the reactions from the family. When a person who is withdrawn and isolated, not doing anything, not going to school, not doing their job properly, not doing anything, sleeping or lying down most of the time, such people, the parents usually tend to react to that. They scold them or threaten them, or parents also react very badly. And in such cases, the threat happens. So see, if you don't want me, I don't want to live. I take my life. I'll show you everything. That sort of threat coming from students or adolescent girls. And indirect comments also is there. Like they are not threats actually. I find it very difficult to leave. I don't want to leave. It is better that I am not here. I have no other way. And such comments like as if they have lost all hope about life or future and they have nothing else to hope for. Like such comments will be there. Like, there is no other way. This is the only way I can. Somehow I want to escape from this problem. Such comments are also indications or warning signs for the risk of suicide. Some people we have noticed, some of us might have heard or noticed, like making preparations for the last journey, like they write letters or write suicide notes. Some writing wills actually for older people, and giving away prized possessions to people they love. Like they have some precious things, but they part with that, give it to somebody. Such changes. And another thing which is noticed in the psychiatric scenario is a person who is withdrawn, loss of interest in everything, such mood changes. Are they suddenly, all on a sudden, one day, they suddenly become all right. So that sudden change also we have to take into notice. They are relieved of the stress, they have decided something. And so we have to be extra careful about such people who show a sudden improvement in their symptom for a one all on a sudden. So these are the warning signs we have to keep in mind. And the methods of suicide we have heard in media, like hanging, is a very common method of suicide. Then poisoning, consuming poisons, overdose of medications, drowning, or self-immolation methods like fire setting or jumping from a height. All these things are suicidal methods they have noticed. And so what we can do? Prevention of suicide. Prevention, how to prevent it? See, recent September 10th was the World Suicide Prevention Day. And this year's theme is working together to prevent suicide. And so I think today's topic is also relevant to this year's theme. So we all have to different people from different areas of mental health and related field have to work together. And we have noticed that in most of the suicide victims are actually not very weak or selfish or cowards. They are people like us. But at some point of time, they have lost hope in everything and they think that they have no other way out. So they resort to this suicide. So what we can do is there are many areas where we can help them. It is actually a multi-sectoral approach. Need coordination from various agencies. The aim is to raise the awareness and not to bring stigma to the area. And suicide and related things, people are attach so much of stigma to these things. So the idea is to talk about it without any inhibitions, and while you discuss about this, it will improve the awareness among the public and the people around. And intervention as there are three levels of intervention. Like one is the individual level. We have to do is the assessment of the risk of suicide in a person. So when you meet a person who is at risk or who is who has already attempted a suicide but escaped. Such people are the focus. The ethno history and the collection of information from the person or the family will help us to assess the risk of the suicide in such person and what we can do about this based on this information. Actually, a teenager should be allowed to talk to the professional alone, and adequate confidentiality should be maintained or required. And preventions we discuss preventions in three levels. Primary prevention. Primary prevention is prevention of a suicide which has not occurred. So in primary prevention, we focus mainly on a person. We have to identify a person at high risk and then intervening before the suicidal behavior occurs. So primary prevention actually it is focusing on individual level and then we have to prevent the suicide from happening. And the method is the mental health education and life skill training to the concerned group, high risk group, and bringing down the stress in them and what they face, what that all you can collect during the information collecting, and then treating the underlying problem or helping them to find solution for their problem. At individual level, the steps we have to follow. This is of importance to you students also. That's why we talk about it, a few lines about it. Individual level, while talking to the person, our aim is to identify the risk and assess the level of risk. And best thing is talk to the person. Like we say that breaking the silence. Talking to the person, there is some myth about it. There are people who think that when you talk about discussion, suicide in a person, like when you know the person who is withdrawn, isolated, looking depressed, different from what they were for a period, some people are reluctant to ask them why, what happened, what is in your mind, such things. As to the extent that when some people think that if you talk about are you planning to take your life, such things, uh, are you thinking of something negative like suicide, the talk itself will provoke the person to commit suicide. That is what most often people think. Actually, you don't have to keep away from this. You have to be tactfully ask such people about their intention. Asking itself doesn't increase the risk of suicide. Sometimes it may avert the suicide and help the person, because most often when people who escape a suicide, very often when they come to clinic and later when they undergo counseling, many of them say that if somebody had asked me about it, I shouldn't have done this. If somebody has was there to listen to me, if before I did this act, if somebody was there to talk to me, I wouldn't have gone for this. Many of them express this wish once they come out of it. So it is important that whenever you have a doubt about a close person, different from what they're behaving from, before, and think that there is something unusual about it, you just talk. How to do it? Like how to talk about these things. First thing is you have to assure confidentiality, and you should be willing to talk to the person and listen to them. Sometimes during sessions we see people who lose their control, and we have a person who is listening should have the patience to listen to them to some extent or many extent, some time, like we have to spare some time for them. You have to express your willingness to listen to them. Sometimes they lose their control, many negative things will come out of their mind, all on a sudden. Sometimes we have to stop it also, because that person may become uncooperative. But you have to allow them to ventilate. Talk, allow them to talk and ventilate, whatever way they feel. But always you should have a control on your emotions and a control on that person. and talk to them openly and tactfully, actually. Be another very important thing is you don't be judgmental. Don't be judgmental in talking to them. Like when you talk to them, don't think that this is right or wrong. They should not. There need not be any debate on you are doing the wrong thing. What you are doing is not correct. This is bad. This is good. That debate should not be there. Talk to them. Let them say whatever they want. And later you keep all these things in mind when you do the intervention or when you direct to the professional. And the next step is make the person and the family understand that there are people like we are interested in them and we are ready to support them and offer them hope that there are some other alternatives available rather than what they are thinking. Like I mentioned earlier, narrowing the perception about the options are narrowed. So let them talk while talking to them, give them hope that there are other alternatives available. But actually, hope is generated through the presence of somebody who is willing to listen to them and share their feelings. Like when you talk to that person, show interest in him and willingly listen to them, and they feel that, okay, this person may be able to help me. But at this point, very important thing is that you have to be realistic in this. You have to be realistic and don't give any false hope for the or promises. One has to work on the available resources and help them to cope with the real situations. And when actually next step is actually for involving the family members in the intervention. You have to talk to the family, parents, or relatives, or somebody who is close to the person. Sometimes we come across people where the person is actually not attached to the parents, but they'll have some relatives who is close to and confide. So they'll ask, you talk to that person, don't call my parents. Such things we come across. But actually, we have to prepare the family also for this. Like family, make the family also adapt because a person who is having such plans in your mind and the parents are not aware, most often the mothers, they are upset and shocked about this and they also lose their control. That is, sometimes we have come across cases like that. So we have, what we have to do is we have to help the family adapt to this crisis and accept the problem. And then handling the conflicts in the family and help them to improve the communications between the family members and the person concerned. And also, like during this intervention, we can identify some problems in the family. Like in that case, we have to address that also. That actually is a professional approach, and that we'll talk about it later also. And another intervention that you do in primary prevention is, I told no, depression, anxiety, mental illness, sort of mental illness is a cause for suicide. So you have to go for a medical management. Medical management in treating an underlying psychiatric illness like drugs to control the depressive episode or psychotic episode, and certain drugs to control the behavior of the person. And you have to go for other sort of management like counseling and guidance or supportive psychotherapy to help these individuals. In the therapy, actually, what we do is you have to manage their feelings by relaxation techniques, distracting the negative feelings to something positive. This you have to help the patient to practice. That is a professional approach done by a trained psychiatrist or clinical psychologist. Practicing to relax and distract themselves from negative feelings. Change, cognitive behavioral therapy is also another method of therapy where you manipulate the thoughts, teaching the person to distract from negative thoughts and bringing some positive thoughts and some positive things that make them feel the need to live. And the secondary prevention involves the early identification of a high-risk group and prompt treatment of the mental illness that has people who have escaped the suicide attempt, and then further suicide and negative events we have to prevent. In that case also, it's almost like a primary prevention. Steps are almost the same, but the only thing is that we are trying to prevent the further attempts and further negative events in their life. Here also, again, you have to talk to the person, allowing them to ventilate their problems, listening to them carefully, giving them time to talk about their issues, giving them hope, and helping them find other methods to cope with the problems, such things. And in this level of prevention, usually we go for individual counseling, psychotherapy, like supportive therapy or cognitive therapy. Then again, as mentioned in the first step, like family intervention, treatment of the underlying psychiatric illness like depression, psychosis, anxiety disorders, problems with drug abuse, the person who is severe addiction to drugs, all these have to be medically managed along with counseling and therapy. Here again, the same steps we follow, like assure them the confidentiality, willingness to listen to them, allow them to ventilate, talk to them and deal with them tactfully, offer them hope, but at the same time, you have to be realistic in the expectations and the outcome. And most often, this session, we have to do it in different sessions. And while we end the session, we have to make a personal contract with the person. Like, don't go in for this last resort till we meet again. That's what you do. And like before we meet again, don't do anything negative about this. And we have the therapist and the person concerned will enter into a contract, and that itself will help them maintain some sort of balance in their life, and they feel that somebody is already taking interest in you. And during this period, at the same time, we have to do the family intervention also, because in many of the cases there is a conflict in the family between the person and the family members. Some of the stresses are due to this difference, conflict in the ideas between the person and the family members, or some pathology within the family which has to be addressed separately. Then we come to the tertiary prevention. Tertiary prevention is how to prevent further episodes in the society and further new incidents of suicide or such negative events. Like for this, we have the parents and teachers have to work hand in hand with the mental health professional. And for that, we have to work with the family, improving the communication within the family, and again, the same thing, handling the conflicts. This sort of family intervention and individual counseling goes in all these steps of prevention. Some of the parenting methods are faulty parenting, like overprotective and over-involving parents, or parental neglect, mental illness in the parent, any of the parent, or causing stress for the child or the adolescent or the adult. And so identifying, like improving the communication within the family, handling the family conflicts, helping the family accept this person and adapt to the crisis, and to manage further incidents, and identifying the pathological processes in the family. The next step in tertiary prevention is mobilizing resources to bring down the stress in the family. Like this is a sort of psychosocial approach. Support from outside, like bringing down the stress in the family, like financial burden or financial burden or loss of job in a family member, or some stresses like that, which can be solved using financial aid, or some safe help them to enter into some safety plans. Government agencies doing some direct money transfer, such plans which is organized at different levels in the panchayat level or in the state level or national level. Then regular uh, contact with the patient, a follow-up, which is there along with the contract we make with the person. Like you have to contact them over phone or allow them to contact you over the phone, sending some cards, reminders. That is when the gap is long. Initially, make the contact very often, meet in person frequently, discuss things, helping them to cope with the situation. And at the most, the person is the changes which we bring to the person is showing our interest in this person and making him think that he is useful to the person, or somebody is trying to help him, or somebody is showing interest in him, so he can hope for something better. And that in tertiary prevention, another very important intervention we do is in the society level. Intervention at the society level. What we do is creating awareness uh, in the public through awareness programs. Through awareness programs like addressing the mental health issues through the media. Media in the sense you have social media, computer, TV, radio, many programs we can organize, like a short film, some articles in newspapers, magazines, live shows with doctors' advice, live programs where you can talk to the doctor, address your questions. Such programs through media, you can create awareness. And again, bringing together government organizations, NGOs, and family and friends to work together. And when all these systems come into place, the awareness among the public can also be increased. And the stigma attached to this mental health problems, mental health issues, suicide, all these things, the amount of stigma attached to this also will come down naturally. School-based interventions is another thing which we can improve the uh, awareness among the public, like children in school, including the mental health topics in school and college. Like children, when they read about it need not be very large topic, but short topics which help them that there are certain conditions like this. This awareness in a child or an adolescent student will help them to improve themselves, or they can identify such people among them and help them, or report to the senior people, and such awareness will help them to prevent any untoward incidents. Creating awareness to the parents and teachers during the PTA meetings. In PTA meetings, usually in many other schools, there's a program where they invite a guest speaker and address some issues. So, in such a meeting, you can call a mental health professional or person who is working in this field and help them share their views and ideas and their plans, so that the teachers and parents also become aware of incidents which is happening, so that the teachers will be more focusing on the changes in the students' behavior, and they can help students to face problems in the studies. And Not only that, the parents and teachers, if they are aware that some of the things which are causing stress in the students, and they go to the extremes of taking their life, they'll be more careful when they deal with the teachers, when they deal with the students, or when a parent deal with their children, they'll be more careful. So this sort of creating awareness definitely is useful. And in school curriculum, other than this, you can include the life skill training topics. Like need not be all the life skill training, but some sort of self-awareness and self-esteem and problem-solving skills, coping skills, communication skills, developing empathy in them so that they can understand somebody who is different from them. Or when they have a problem, the other person, if they have a quality of empathy, they'll be able to understand and help the person who is in problem. So, teaching life skills in schools through trainers. There are people who have training in this field, and then they'll be able to help students develop these skills. Like this is life skills are actually not the solution for everything, but it helps a person to find solutions with the available resources. Or sometimes, okay, you will be able to uh, leave it like that. Certain problems you don't have a solution for that. But actually, when you don't have a solution, at least you have the mind to leave it at that, and then carry on with the life. Like everything won't be positive in your life, but negative things you can ignore or improve or leave it like that and carry on with the life. So such things like problem solving and coping skills helps to uh, deal with such things. And communication skills, that's actually a person uh, helping a person to communicate their thoughts. Some people are reluctant to talk about negative things of personal importance. Personally, they don't want to talk about things, but they will talk about other things. So actually, if there's a communication skill, if person develops in a school level, they will be able to talk about their problems. Or a person who has got good communication skills, they will be able to identify a problem uh, peer and a classmate and help them communicate or talk to them and bring out the problems in them. So training for teachers is another tertiary level of prevention intervention, like training the teachers, ASHA workers or NGOs in identifying the children at risk, like depression, substance use, problem with learning, and directing them. They have to, only thing they have to identify, they are aware, they have to be aware of such things and able to identify problems and then directing them to the professional to seek treatment. Treatment in the sense it can be counseling or psychotherapy or drug intervention. And at the society level, another thing we can do is restriction of access to the lethal means. Lethal means like poison, drugs, firearms, weapons, pesticides, all these things are used for suicide. So, in the society level, at the government level, uh, like you can make amendments in laws or certain laws you can make to restrict the availability of such means so that the incidence of suicide is not that easy as before. So we can, to some extent, we'll be able to prevent suicide incidents, like uh, restricting the means of suicide, like poisons or drugs or firearms or weapons or pesticides. Another thing we have to make use of is the media. Media is always helpful in creating awareness. Media play their role in creating awareness about many things. Many things we get through the media. Responsible reporting is something which media has to abide with in creating awareness, but responsible reporting, like creating a sensation and glorifying certain incidents through their report, such things are not actually good for the public. Some celebrity suicide. When it is such a news in the column, there are recent incident of a person who committed suicide in the film world. But there were reports that some of his fans committed suicide. Such incidents, one thing is that there is some problem with the personality of such people. But again, the reporting which give more importance, and then it may induce a thought of suicide, and they get frantic about it. And another thing media can use is sensitizing the policy makers regarding the sustainable methods to bring down the suicide and attempted suicide. Then such things like you can publish articles in newspapers, uh, talk with professionals in the media, live talks, all these things will the help them in bringing down the suicide rate and also the create awareness in the people. And another thing we have to follow in preventing suicide is always stay connected. Stay connected to somebody, something. Like for that, we have helplines. There are many helplines available in state and India, and it's state-wise also there are problems. Telephonic counseling is there, and there are certain organizations and state programs that give helping hand in uh, people who are in distress, like Tunnel and Maitri are organizations which work in Kerala. You give psychosocial support to the people. And there are other uh, in, programs like Patakalla, Opamunda, certain projects from the state and center. Manodarpan Chiri project is conducted by the student police cadets. There are programs organized by the state police also, and certain programs by the Psychiatric Society of Kerala, which organize things to prevent the crisis. We'll come to that in the last slide about the whole program. And so, regarding with that, we will be coming to the end of this suicide prevention programs. Like what we have to do is we have to be aware of the suicide, impact of suicide, and then accept that there is this is a major mental health problem and cause of death in uh, adolescents. So we have to go for prevention strategies. Before that, we have to go for identify people who are at risk, and then try to bring down the stress in their life using prevention strategies. Like the main thing is in prevention of this suicide, we focus on promoting mental health and well-being. Help them access to mental health services and give prompt treatment. We have to consider the risk factors and protective factors during intervention. And to prevent suicide, it is early intervention that is help. Early intervention at primary level, like when you intervene before the suicide happens, or at the secondary level, there is an attempt but the person escapes. We have to prevent further incidents and further episodes in the same person. And for that, we have to take into consideration their family, their friends, society, available resources, and bring down the stress in person or the family using economic policies of the government, protecting the basic needs of the people, and mobilizing other support systems. Keeping all these things in the mind, we'll be able to follow this year's uh, theme for suicide prevention, like working together to prevent suicide. Like many professionals in this field who was working in this field have to come together. It includes the teachers, family members, mental health professionals, social workers, all these psychologists, counselors, all these trained people who are working in this field have to come together, work together, and help them to bring down the stress in people, help them face the world with more confidence, improve their mental health, and timely intervention and adequate, appropriate help is the answer to this prevention of suicide. With that, we go to the next topic of today's discussion, and this is something. Please keep that there. This is something which was a campaign for suicide prevention. Can you keep the previous slide and the previous one? Previous one. This was a campaign designed by the publicists in 2018 on suicide prevention for the Samaritans in Singapore. What you see in this is, I am fine. That is what you see. If you keep this slide upside down, you can read it as "save me" also. This is very important because very often people don't express their thoughts. This people with negative thoughts, you don't express negative thoughts. So some people, okay, how are you? Why are you like this? What is this? Is anything wrong? Okay, some people say I am fine, but in that talk also there is a indication like to save me. That actually this is something which was very interesting. So I thought I will bring this slide also into the presentation. Okay, then we'll go to the next. This is a picture representation. You turn it down, we'll read the other way. And thank you. Then we'll go to the other topic of today's discussion, like helping kids how to cope with COVID-19. About coronavirus, what we see is there are a lot of articles and news and everyday news discussions about coronavirus. Actually, this is a new virus. It's an RNA virus, and this virus particle, if it is the virus particle, it can't do anything. Once this virus enters the body of the cell of a human being, this virus replicate and causing problem. The virus, the RNA alone is not able to do anything. But once it's enter the body, that's why when you destroy the virus particle outside the body, it is not causing problem. And so once it enters the body, it creates problems. And in children, actually, what we have to think is the medical aspects and the psychological aspects. As you know, coronavirus disease, COVID is coronavirus disease. Coronavirus, we can all understand that it's a challenging time for everyone, all over the world. And whether you're rich country or poor country or facilities are available or not, it is really a devastating problem or challenging for everyone. Regarding the medical aspects, children are actually not immune to the virus, but it is noticed that children are less infected. one reason may be they are not exposed to the virus, because once they're small children, we are very careful. But even then, there are small children less than 1 year also had got COVID through contact, so from the parent or from somebody else who had COVID, the child also got infected. But usually the incidence of COVID infection in children are less than adults, and the symptoms also are mild unless they have some major health problems. And how to manage the medical aspects? Medical aspects you can easily manage, like to educate the children according to their age. According to their age, you can educate them regarding this coronavirus infection or corona. So that's through videos or short stories, pictures, and encourage them definitely. And we have to encourage them to follow the safety tips. Safety tips, we all know, like we all hear this very often, like washing hands very frequently, use sanitizers, social distancing, like do not touch anybody but wave hand, do not hug but wave hands, use mask or face cover to when you go out, and stay at home or have a healthy lifestyle, the good eating habits. But the psychological impacts COVID-19 has got is more important, more equally important, and also the economic and the social consequences. Other than the mortality or the morbidity, COVID has brought, like the illness per se as such is causing morbidity and mortality, but the social and economic consequences also causing some amount of morbidity and mortality in the common people. It is definitely a challenging time for everyone all over the world. Children are and adolescents are actually more vulnerable to the psychological impact because they experience more stress in the stress level. The level of stress will be more in children and adolescents. During the corona pandemic, they experience more of emotional, and it was reported that there are more behavioral issues in children because they are sitting alone or sitting at home, not able to free themselves and not able to meet their friends or talk to. They usually get together and playing outside, meeting their friends and having a nice time together. All these things were there before the corona period. And now all these things are restricted, and lockdown itself will cause some amount of anxiety in all of them. And actually, anxiety is there, fear is there, and the frequent news about the illness also is creating panic. So what parents parents can do is no need to expose to these negative news is very frequently, but adequate enough to give them update about the problem and the safety they have to follow. So the common problem we have noticed is anxiety is there, fear is there, uncertainty about the future. What next? When the classes will start? What about the illness? How is this going to end? Will it continue for years? So how can these children are always worried? Actually, all of us are worried about this. How many months we have to wait? How many what all precautions we have to continue like this? Is some wearing mask and the restrictions itself is frustrating to all of us. So imagine the problem it creates in the children. So frustrations and mood changes or irritability. Reason for that is often not able to go out, not able to play in groups, not able to meet their friends. They are not able to share their little things which found interesting, or some interest they can share with friends, but not with family. So the group activities, all this outside play, all this were restricted. So it caused frustrations and mood changes. and irritability, and because of that, this mood change, irritability is there. Irritability, some are feeling sad and worried, and sometimes getting up at night and sleep, crying or weeping, sometimes screaming. Certain incidents, such things happen. Sleep, that is coming, like sleep disturbance in some children, weeping spells, or irregular habits in eating and sleeping. This is something which is happening very routine is already don't have to go to school, they don't have to give any time. The work schedule also has changed. So they get up. I've had complaints from parents like they sleep by 12, 1, 2, and then get up. They some of them are having the breakfast by 10 or 11 o'clock. Imagine what time they are getting up. So their basic routine in their life is also lost, which is also a consequence of this corona pandemic. And it is causing issues in the family, like parents having stress due to the financial constraints, loss of job or loss of steady job, problems in the family, like uh, earlier both parents are working, or one parent is working, other person is looking after the family, but they were not there. If the parents are in conflict, there are problems between the parents, then all of them are there at home. And so that is creating problems, because there are reports about uh, violence and abuse, which is increasing during the corona period in the family, because the problem, people who have problem in their relationship are always together, and so they have difficulty in getting along well, causing violence and unnecessary undesirable consequences, causing stress in the family and children or the students, and exposure to this violence. Children are also exposed to violence, beating by father who is an alcoholic, or a person who has got poor temperament in managing skills, or a father who lost job and he is depressed, but he has got uh, not have emotional discontrol, so they lose control. Children are also exposed to violence by the parents. For older children, the problem usually we come across all these things are there, anxiety is there, adjustment problems are there, uncertainty is there, because they are of higher class, plus 1, plus 2, or 10. What happens to the 10th degree? What about the admission? How will it happen? About the next class we have to go? How is it going to happen? The exams? How can you do the lessons? All these are causing problems for them. Uncertainty in the anxiety in the future. And the problem this older children are entering into is they are they are attending online classes. Online classes, they are most families who had the number of phones in the family has increased now. And the students are actually, we were restricting phone use by the most often parents were, there are parents who give phone to them, individual phone also, some children own, but often children are not permitted to use phone. But now the children have got the permission to use the phone because they have to attend online class. Some of the children are making use of in a positive, negative way, like they were happy that they can use the phone for other purpose also, like playing games, entering into other social media games, or other exposure to other areas in the online. But some for some children, this is causing also stress. Like online game, they have started playing, and then some of them are addicted to this game playing, and then they find it difficult to stop. When somebody put restrictions, they lose their control, and then getting frustrated, or showing mood changes, violence, or temperamental changes. That is an indication that these children are getting addicted to this form. Other thing is some children, by their fault or otherwise, uh, are victims in the cyber world, like bullying, or they enter into some issues which they cannot divulge properly, and then they cannot talk to anybody, some like victims of online crimes. So these are the problems they face. So how to cope with this? How to help these children cope with this? Parents and family have an important to play role to play in helping these children. To deal with the corona infection, the only thing is to create awareness about the coronavirus and the outcome, but not to the extent of creating panic. Don't create panic in them, but give them adequate information to keep them aware. And safe use of media and phone, and the restriction of screen time. And about managing online classes, what they can do is parents have to supervise their online classes, how they use the screen or technology, and they can supervise them so that they can find out other undesirable behavior in this child, like using the phone for other purposes, like using some incidents of this PUBG game, which was later decided to restrict this game and all in online. But all these things, when the parents are aware and then look for it, they'll be able to find out how to reach out to these children. Reaching out to these children, as parents should spend more time with the children rather than supervising and restricting and controlling using the authority. You spend more time, be friendly with them. Parents cannot. There is one view that parents have to be like friends, but what personally feel is parents can't be friends, but parents can be friendly. You can always be friendly with your children. Don't show your authority over it, but able to understand them, but able to control them also, tactfully and appropriately. So what parents can do is spend time with them and observe them without scrutinizing, as if children should not feel that they are always after them. They will start blaming parents and talking back to them. And listening to them, reassuring them regarding their worries about corona, and making them understanding about the online difficulties and the problems they have to face. But another thing is that about the corona pandemic, parents, when they discuss about these things in front of their children, we are also anxious. Parents and older people, we are also anxious. But you don't have to express these things in front of the smaller children, because children get panic, but they can't talk. Another way of bringing down this anxiety in children is keeping them engaged. Give them some activities at home, like giving small tasks to complete on time, and make them feel good and responsible. Like a sense of responsibility in them can be encouraged, like behaving responsibly. Give a plan for a day and how to manage the time. And often we have to prioritize self-care first, like making a routine for our own daily activities, like eating healthy food, eating on time, exercise, some activities to help you move your body, sleep routine. There should be a sleeping time routine. Whether you have to go to school at 7:30 or 8 or not, doesn't matter, or you don't have to go to school, but there should be a routine in going to sleep, getting up, involving in activities, daily activities, personal care activities, all these things, you have to keep a routine, and the parent should monitor these things in a positive way rather than becoming more critical. Don't have to be over involving or over critical, and like parents don't have to be critical about this, but they can give suggestions. I also always say that you have to repeatedly tell your children to do certain things. They may not obey it in the first time, the second time, the third time also. You have to say the same thing in the. You have to say the same thing, repeat the same thing on for a fifth time also without losing a patient. That is the primary responsibility of a parent. And the parent, that's why I said parents can be friendly in dealing with the children. So when they help them to keep a routine, you don't have to lose your control, but help them tactfully deal with this routine and activities in the family. And of course, when you follow them always, you can restrict the social media. You don't have to shout at your child to stop it or put an end to this, but you can say this is not good. There is enough time. Your time is over. So often children, they are only 5 minutes, 5 minutes more, only 2 minutes. This will end. Okay, you can allow them, but you can give a warning that time. See whether it end or not. We'll have to stop it within 10 minutes. Such restrictions you can put, and then encourage them to follow that. And again, this attending online class, we have already told, attending online class under the supervision of the parents, so that we can see how the child perform, how the other children in the class performing, and whether they are attending the class or in between fooling us, like most of the parents, including me, I would say, uh, we don't have much knowledge about this new technologies like our children. So they can easily fool us. So at least you can follow this trend every time. You will also get used to this and you will have some ideas about it. And another thing is activities for the kids. For the kids, you can fill in the day with activities, like some learning activities you can do, like reading books, making them read books, or you read books for them. For smaller children, somebody has to read the books like story books or some short about famous people, small things. In minimal words, you have impart this idea of certain famous people in our country or such people, like some sort of reading, stories or things of learning. And you can enter into activities like pen, pencil, paper works. You can you do some sketching, or you read, I mean, make some like copywriting. Copywriting, you can do this during this period. Give them pencil and book, and help them, give them a portion which was taught that day or previous day, which the child has not gone through. Teach them, ask them to copy. It will definitely three things will three things can happen because of this. Like when you teach these children about the portion they have already taken in the class, ask them to copy it. Like it improves their memory. And if you do it in a copy book, it will improve your handwriting. And your coordination also, hand-eye coordination also will improve. That also will improve the concentration. So many things will improve with this simple task. Another learning activity you can do is puzzles. Puzzles, according to the age of the children, you can choose the puzzle. There are certain magazines where you give one or two puzzles every week or every month in that magazine is there. So follow these puzzles, some word games, spelling games. For that, the mother or the father or somebody who's grown up have to sit with the child. And this is also helping the child. It can be a word game, like spelling. You can make it a puzzle by putting dash in one of the one or two spelling areas, and then help the child to fill it up. So this also you can create it as a game, and it help the word powers in the children, help them to know the spellings, and at the same time, the child is involving in some activities with the parent. So the sense of closeness, the child feels secure that you are interested in the child, spending time for the child. So it will give a sense of wellness and confidence in the child. And all these things will help them in their learning process. And creative activities, another thing we can ask the children to do is coloring or drawing. Children who is good at drawing, we can encourage them to draw pictures, give them book and pencil, and then ask them to make a few sketches every day, 1 or 2 pages, 1 or 2 sketches every day that who have talent in drawing, so that it will improve their talents. And we can also, if you keep a book, usually I tell my parents to keep a date on which date you draw this. So after 1 month or even after a few months, you can see what this child was performing and how much the child has improved. This drawing for talented children. Or if children who likes to draw also, you can follow this. You follow this drawing session. Coloring also everyone can do. Only thing is that you have to have some patience and some concentration power. Or those for children who don't have who don't have any talent in this coloring also, the parents can help. Sit with them, ask them to encourage them to do the coloring, to complete them. Because many of children, it will actually coloring the children concentration and the coordination power will improve. That will help them to improve your brain functions. So you buy a coloring book for them because already the picture is drawn. You don't have to draw a picture. For parents who are creative or who are talented in drawing, you can buy a book, draw pictures in that, and ask the child to color it. And you can also help them. Like coloring and drawing, you can do craft work. Again, in the YouTube and all, you get a lot of things, guidance in doing this work with papers and plastic articles, like discarded things you can remake into some useful or colorful things, and the children will feel more confident about it. And like making cards or small toys, clay modeling for those who are artistic in that. So all these things, activities will fill their time. They don't have time to worry about the corona, or their anxiety will come down. And the troubles they are making also is coming down because of these activities you are involving in. Other activities are some movement activities, like because of these restrictions in movements and going out, not meeting friends, they are restricted to the home. So ask them to involving some play games like cycling or skipping or running, such sort of things you can do. Gardening, flowers or vegetable gardens. This activity which help, many things are involved in this, like gardening. It is really useful for your own use. Children will have more interest in this nature and nature's way of functioning. All these things they will more attached to this nature. So some of the older generation have lost touch with that, and it is our duty to bring children back to nature. And music or dance or this group things which you can perform at home, which help them to move and the sort of some act as some exercise. It brings some confidence in them or sense of wellness, some mood elevating things. Actually, all these activities bring some positive chemical changes in the brain also. So these things will bring down their anxiety, negative feelings, depression, all these things. And along with that, you can help the child in helping somebody, bring some smile into somebody, doing some good things in life. As children, you start doing things, definitely they will have that qualities they develop in. And along with that, you again I mentioned about life skills in children. In children, teaching life skills is like simple, they have to get used to something which is not available. They they have to suppress your desire or need for something. You have to keep away, like gratification. You delay the gratification. That is something which you can teach your children in home, like in your home. Like delaying the gratification of getting something. Delaying the gratification in the sense uh, you wish to have something, but you cannot get it now. You have to wait for some time, maybe days, or it is something which involves some money cost, and so the parents say we don't have that much money now. I'll buy it some other time. So the child definitely will have some negative reactions, but helping to cope with that, like delaying the gratification to some time or some extent, you're teaching the child to wait for the turn, or you can discard certain things in life. If you don't get it, don't have to get frustrated. Such learning experiences you can teach the children at home. And other things you can teach small tasks in daily life, like watering plants. Again, the gardening thing will come, watering plants, keeping things in order, cleaning the room for all the children, washing plates for all the children. Like small children, they can fold their clothes. Other children like washing their clothes, and even if there is washing machine, you can keep dry it and fold it and keep it in each person's drawer. Such things, it's a simple task they have to follow. They will get the habit of. And for older children, they can help in cooking. For older children, you have to be more careful about the use of media. The danger of involving an unhealthy use of media is like screen addiction. That is between 12 and 20 years. And help them to seek professional help in case of children who are in need of help, like they are in distress. In spite of the activities that I just mentioned are those for children who carry out as a routine. But there are children who is extremely anxious or depressed or scared about this corona or otherwise, or they are worried about the school's uncertainty in school or teaching problems or problems in attending the online classes. For such children, you have to seek professional help. Like the parent should call the teacher. Teachers can guide them for counseling or supportive psychotherapy, or you can look for a professional psychiatrist or a clinical psychologist who can help the child or the adolescent to get over the crisis. Most important again is to stay in touch with family, friends. You can message, call them over phone, follow them, like making friends with them or calling them frequently, messaging, appropriate way of messaging, keeping in touch. And here are some of the projects and helpline. This is for the, I thought I will keep this slide as the last, because there are this is some of the support programs I happened to come across when I went through this. Like support programs, HACS is actually it is now it is, the number is there. Now it is a police counseling center, but it will be open for the public also later. But of course, you can contact them. And the DGP in Fire and Rescue is Dr. R. Srilekha is in charge of it. And the Kerala Police Emergency Response Support System is there. Childline is always there. Disha helpline also offer psychosocial support. Tunnel is there. Maitri is there. Other helpline like we help. The number is there. And the recent project which was launched for the children, like the Chiri project, actually it was launched in the July 12th of 2020. It is run by the students police cadet. It is set up by the state police to reduce the mental stress in children during the corona period. And it was launched in July 12th, but it says that over 2,500 calls was received in 1.5 months' time. It is done by the person who is attending the call will be a student police cadet, and it will be direct. It is supervised under the supervision of trained teachers or counselors, so that when they have a confusion, the call will be directed to the senior person. And if it is in genuine need, they contact them directly or allow them to contact them, and then direct them to professionals to seek help in case of problems. Another project was launched in June 2020 was Patekalla Oppamund. It is a psychosocial support project. Its aim was to address the mental health needs of the public during COVID-19. The scheme later extended to the students in view of the exam results, which was coming soon after that. And so it was told that many students responded to it, and they had to attend the calls from many students. And here what they do is, if there's a counselor, speak to the student, and if the counselor feels that there is some issue with the student, they talk to the parents and they have a detailed counseling. And then if they feel that there is a problem, they are sent for a assessment and further therapy by the mental health professional. And Mano Darpan is a helpline for students' mental health launched by the HRD ministry. It is managed by experienced counselors and psychologists and mental health professionals. That's what it says. It's a central project. And Crisis is a Kerala project by the Psychiatric Association, Kerala Integrated Scheme for Intervention in Suicide. It was launched in 2004. Its aim is to train the medical and paramedical personnel to identify depression, suicidal ideas, people at risk of suicide, and doing appropriate intervention on time or directing to the mental health professionals. Another aim is to set up suicide prevention clinics, centers, so that people who are around and they can reach there. Another thing is training teachers and social workers for helping them identify the high-risk cases. School, and they have set up school and college-based programs for stress management. It was done by trainers who have experience in them in managing stress, and mothers to manage, like they'll teach students how to manage their stress, like simple ways. There is another website by the Central Trauma Psychiatry Society, like the website from manasikarogyam.com. In this website, you can approach, it is open to public. Approach there. There are certain areas where you can read articles from written by doctors or professionals. And there's a time when you can talk to the doctor online, contact with doctors. Specific time is there. There's somebody who will come online, and you can access to such people. The details are there in the website. And with that, we'll come to the conclusion. Like suicide prevention, as we told, it's a major public health problem. It is one among the 10 leading causes of death in them. And in adolescent, there is no specific particular reason, but there are many factors which leading to suicide. So, as a mental health professional and people who work in this field, we have to identify such people who are at risk of suicide identify the warning signs, and do some early intervention. And there are 3 stages of intervention, like primary is primary prevention, secondary prevention, and tertiary prevention. And you intervene at different level, like individual level, in the family level, or the society level. Individual level in intervention is more important because that's where you come across the person and get in touch with the person. As we told, no, the primary aim is to focus on promoting mental health and wellness in the person, help them access to the health services and get prompt treatment, considering the risk factors and also the protective factors. We have to look for the protective factors and intervene early as possible. Other policies from the government, projects to help solve the economic crisis or economic burden, then mobilize the other support systems from the family, social support from neighbors or people around you, and using media to create more awareness about this incident, about this suicide ideas and suicide happenings, and so that the public will be more aware and they will come forward to look for it, identify some people who are at risk and may be able to help them. Even though they are not professionals, they will be able to help them, talk to them and listen to them, give their time to them, make them feel wanted, or bring down the loneliness and hopelessness in them. And then use the media properly and guide them and help them to solve their problems. All of us may not be able to be 100% successful in all this, but the effort we put will make you feel some gratification that we have done something to help them. But most often, there are people who are not willing to talk to anybody, but once you approach and they feel that somebody is able to listen to them, they will talk about it. Like breaking the silence is very important in this. Breaking the silence from the victim's part or from our part. And a person who is in need of help should break the silence, or a person who is able to help break the silence and talk to them. Because talking to them or doesn't increase the risk of suicide. But it will always be helpful at some point so that the person will come back from his negative thoughts and negative actions. So with that, I think we'll end the session and about the COVID problems, like coping with. I have discussed in details about it. If you have any doubts or any questions about this, you're free to ask. And about the organizers, what about the time and next, I'll ask the organizers to the next plan.
Ma'am.
Yeah, Anu, what they can do? Are you audible?
Yes, ma'am.
Can you
Hello.
hear?
Yes, ma'am.
Okay. What is your plan now? Shall we conclude the topic and anything you want to ask or anything you want to tell me?
Ma'am, it's a clarification session. Doubts or questions, please ask the speaker, or else you can put it in the chat box.
Okay. in the side box, no?
Ma'am,
Ah,
okay, one question from John. What are the possible warning signs that are showed by a child who have a motive to commit suicide, which could be helpful to the parents or caretakers to protect the child from such misery?
when it comes to child, actually, below 6 years, uh, the act of committing suicide is much less, because maybe it is due to their immature, they are not able to carry out this act or plan the act. But still, you have to be very careful. Like, what are the warning signs? That's what you asked, no? Most often, the children show mood changes. Mood changes in the sense, usually they are withdrawn, talking less, very dull, and not showing interest in anything, not attending to the personal care, like not eating, not sleeping properly. Some children are scared or something, or they feeling very dull and all. Some certain children, they are showing more irritability due to there's no actual reason their parents can notice, but they'll be irritable at some time. So this, when you see these things, usually if a parent is very observant, they'll sit and talk to this child. Another thing I have noticed is that is a bit more older children. They talk to their friend or give some things to their friend, and they won't say anything, but they'll say they'll be parting with their possessions, so that they will give it to somebody else. So that I am not going to use it anyways. You give it to my loved one or somebody, a friend. Such actions you don't have to ignore it, but need not be always. But if you see something different from what your child was doing earlier, there was a difference in the behavior of this child, you have to ask this child, sit and talk with this child rather than scolding or blaming the child. And then, if needed, when you see something unusual, if the child is not telling anything, but the parent still feels that this child is not behaving properly, you definitely take this child to a mental health professional, any psychiatrist or psychologist who is trained in managing these cases, so that they will be able to find out. It may need 1 or 2 sessions, but it will be of help, so that the professionals can. This is a warning for the parents, so that they stay with the child, sleep with the child, stay in the same room, have to be observant, and they can divert this child, engaging in some activities if the child is cooperative. But what they have to do is seek a help. First talk to the child, get some information from the child if possible. If not possible, seek medical help. Definitely, you have to do that. Is it clear? Is it clear for him?
Yes, yes.
Any more question? I know you can ask the question.
I think no more question. Okay. Let's concluding the session. Ma'am,
Okay.
I am audible.
Yeah. Yeah.
Worker Surya Shaj, deliver vote of thanks.
Good afternoon to all. Respected resource person, principal, faculties, and other participants from various states. It's my privilege to deliver vote of thanks on behalf of Sri Shabarisha College and our association Lantern. I express our gratitude to Honorable Speaker of today's discussion, Dr. Jaya Jacob, for leading a great and informative session. Thank you, ma'am. Next, I express a sincere thanks to our principal in charge, Professor V.G. Harish Kumar, for always inspiring and motivating us. Then I would like to thank our faculties, Mr. Gigi Sham, Mr. Nandagishore, Mrs. Neeraja Raj, and Ms. Bimol Assis for their support. Finally, I thank each and every participants gathered here for your valuable presence. Thank you.
Again, thank you all.
നിർത്തിയേക്കാമോ?